Good morning, everybody. Thank you for joining us for this morning's webinar on sport and mental health in young people. My name's Karen Marriage and I'm presenting today with Dr. Reem Ramadan, and we work at Orygen, the National Centre of Excellence in Youth Mental Health. Reem and I both have worked for many years as clinicians working with young people who present with mental health difficulties, and we currently both also work in education roles. And we're particularly interested in helping people who, hopefully like yourselves, come into contact with young people who more than likely will be presenting with some mental health difficulties. So we're excited that you've been able to join us today, because we're really passionate about helping people know a little bit more about what mental health difficulties might look like, and be able to recognise them, pick them up, and have a conversation with young people when they're concerned about them, and know what to do to guide them into getting some appropriate support. So we're really pleased you could join us today, and we hope that you do get something out of the presentation in terms of helping to recognise which young people you might be concerned about in your sporting organisations, and to have a little bit of a sense of what you might be able to do to assist them. Okay, so a little bit of housekeeping. Today's webinar will be recorded, so if you're not able to stay for the duration of the webinar, or if you have colleagues that you think might have liked to have seen the webinar and couldn't be here at this exact time to see it live, it will be uploaded onto the Orygen website, so do feel free to pop back. You'll get a notification email to let you know when it is on the website, so do pop back or let your colleagues know if you found it useful and think that other people might like to get this information also. Come back and have a look at the Orygen website. We also wanted to let you know that throughout the webinar you are able to ask some questions of Reem and myself. So you'll notice that you have a dialogue box like this one on the right hand side of your screen. You are able to type some questions into that text box at the bottom of the little screen, and those questions will only be seen by Reem and myself, so the other participants in the webinar won't see your questions. So do feel free to ask any questions or provide any comments that you'd like us to see. We'll do our best to answer those questions at the end of the webinar or throughout if we think they're relevant. If we get a lot of questions, we may not get to yours, but we'll do our best. And if there are a few that are on the same theme, we'll cluster them together and see whether we can give a go at answering them in one go. Okay. We'll also be asking you some questions of you throughout the webinar. So you'll see a little screen like this if we have a poll coming up, and that means that we would like to get some information from you to help us get a sense of who we've got coming along to the webinar today, so that we can try and tailor the information better to you. Okay, and that's how we're going to start. So we're going to start by trying to get a sense of who you are and what your main role is with young people. So we'll pop a poll question up now, and if you're able to answer it, we would love to hear in what capacity you're working with young people or coming into contact with young people. So whether you're in a teaching and education type role, or whether you're a volunteer or an official in a sporting capacity, whether you are a wellbeing or a support person or a counsellor, so having a more helping type role, whether you're a family member, or whether you don't fall into any of those categories. And if you don't fall into any of those categories, we would really love it if you're able to type a little comment in the question box to let us know what role you are coming to us from. Okay, so we can see some of the answers here, and it looks as though, okay, so we've got a lot of people who are in a helping type role with young people. Okay, that's good information from us. Some of you, a small proportion of you, are in education. Okay, that's helpful for us to know. Thanks. Okay, we need to get the right slide up for you. Okay. Another poll question. We're wanting to get a sense of how confident people feel about having conversations with young people around mental health. Oh, actually, no, I'm jumping ahead. We have a second question around what the main sport that you're involved in with young people. So if you are from the sporting sector, can you let us know which sport it is that you're involved in? And if there's another, type it into the question box. We're interested to know what sporting categories you're falling into. I'll give you a second to answer. Okay. If we can have a look at the answers. Footy, most of you from footy. And I know that you're around the country, so just because we're Victorian, football might not mean really the only true football, AFL, I suppose. Some of you might be from rugby. Okay, that's good for us to know. Okay, and the question I thought that was coming earlier, can you give us a sense of how frequently you're talking to young people about mental health issues in your role? So is it something that you're doing very often or not at all? And that'll help us to know how much information you already have about this topic. Okay, let's have a look. Okay, so some of you are talking about mental health with young people very often, and actually it seems that for almost half of you it is part of your daily role. Okay, that's good for us to know. The information that we're giving today will be of a relatively general nature, so some of you may know some of the things that we're talking about. What we're really wanting to emphasise is that if you're working with young people, it is highly likely that some of them will present with mental health difficulties, and we're wanting people who are bumping into young people out there in the community to feel okay about having conversations about mental health, and that's particularly where we're coming from. So to set the scene, we wanted to have a little bit of a think about what is mental health, what are mental health problems, and how do we define what looks like a disorder? So when do things get so difficult that we would think about calling the difficulties a disorder? Importantly, we know that most human beings don't sit in one of these three categories neatly all the time. So people will move up and down on a continuum. It's almost part of being human. So depending on what you're struggling with and what life is throwing at you, most people will move up and down on this continuum at any given point in time. So if you're lucky, you might move between the mentally healthy spot on the continuum to mental health problems. But we know that many people, young people and adults throughout the lifespan, will sometimes find themselves moving up the spectrum toward having a diagnosable mental health disorder. So the World Health Organization talks to us about a definition of what mental health means, and they talk about people being able to realise your own potential. So it's quite an individual thing. Your potential might be different to mine, but if somebody's mentally healthy, they're able to meet their own level of potential. They talk about people being able to cope with the normal stresses of life. So life throws stress at all of us, and when somebody is doing well with their mental health, they can usually manage those stressors without things going too far awry for them. And the definition from the Mental Health Organisation of mental health also talks about being able to work productively and fruitfully and make a contribution to your community. So we'll keep that in mind, that being mentally healthy also has something to do with how you're able to function in your roles and how you're able to do the things that are expected of you, whether that be personally or professionally. So that's mental health. Mental health problems, we would start to think that people were having mental health problems when they're having some difficulties with how they're thinking, maybe how they're feeling, and maybe you might start to see some differences in their behaviours if they're starting to get to the point of having some mental health problems. So we might think about somebody who's having some issues with sadness or anxiety. They might be feeling more irritable. They might be having some difficulties with their sleep. But they're not getting to the point where we would think they have a diagnosable disorder. That third bubble where people are getting toward mental health disorders is where we would be thinking that people, where the problems are persisting, so they're not going away very quickly, and they are beginning to cause people quite significant distress, and also that it's getting in the way of that really important aspect of their functioning. So they're beginning to have problems with their thinking, feelings and behaviour that get in the way of them being able to continue to do the things that they would otherwise be doing. So that might be socially, it might be professionally. For young people, it might be at school, and it can also be in their sport. So when things start to get so difficult that they're getting into the point of being in the category of having a diagnosable mental disorder, you may begin to notice that their performance in things like sport and education might begin to suffer. So we hope that gives you a bit of a sense that people do move up and down along this continuum from being mentally healthy to having mental health problems and disorders. And that any one person doesn't sit in one of those spots. So if you have a diagnosable mental health difficulty now, that is not necessarily where you'll always be. And with help and support and intervention, we're hoping that people will move back down towards mentally healthy. Okay. Just a word about sport. If you're working in the sporting sector, I think you probably have seen this, that we know that a positive, supportive sporting environment can be particularly beneficial for young people's mental state and mental health. It has many advantages, and these are some of the things that research is showing us, that young people who are engaged in regular physical activity and sporting endeavours do have improved mood. So there's quite a growing amount of evidence that says to us that people who are regularly physically active do better with things like depression and anxiety, that they have demonstrable improvement in their mood from being physically active. So that's a great benefit for young people to participating in sport. We know that they feel better about themselves, so they might perceive themselves as fitter, more capable, competent. They might have higher self-esteem from the very act of being involved in sport, and those are quite protective in terms of people's mental well-being. They'll be more satisfied with their life if they're involved in sport. They'll have often better health attitudes and behaviours. Better capacity to regulate themselves is an interesting one. So the data is telling us that people who engage regularly in sport are better able to do things like regulate their mood and behaviour, which means noticing how they're going and making decisions to alter their behaviour in line with sort of what's socially acceptable. They feel more confident, and also they're more demonstrating more pro-social behaviours, which helps them to be more socially connected, helps them to form friendships, helps them to belong, and those things are very clearly connected to better mental health outcomes. So by the very nature of them being involved in the sporting sector, they're hopefully showing some of these protective factors that will help to give them better mental health outcomes. So that's a wonderful thing, but we know that everybody involved in sport is not necessarily doing so well. So the rest of the webinar will be talking to you a little bit more about when things aren't going so well with the mental health of the young people that you might be seeing within your sporting organisations. Okay, hand over to Reem.
Great. So where we thought we'd first start is just some questions of you about some myths or facts that kind of common in when we think about mental health. So the first myth or fact is that stigma is one of the biggest problems for young people with mental illness. So if you could just take a moment to let us know what you think about that statement, and whether you think it's a myth or whether you think it's a fact. Okay, so maybe we can have a look at what people think there. Okay, so it looks like everyone here thinks it's a fact, which is great news, because yes, what the research shows is that actually stigma is one of the biggest problems for young people with mental illness, and it's what stops young people from going to seek support when they're struggling. And I guess that's why we think that you have a great role in encouraging and promoting mental health awareness and encouraging young people to get help and reducing the stigma around it. So that's great news that you all agree with that. Okay, so the next one is mental illness is caused by personal weakness. So if you could say whether you think that's a myth or a fact, if it's true. Okay, so if you think it's true or if you think it's false. And that's another great result, that everyone thinks that that's false. And of course we know that there's in the sporting world as well as in general population is that lots of people can suffer from mental illnesses, and it isn't caused by personal weakness. As Karen was talking about, there is a continuum of mental health, and that personal weakness isn't a reason that people might suffer from mental health problems, although there are people that who may think that, and that might be one of the reasons that stigma is so widespread. So I'm really glad that all of you think that's false. Okay. The next one is the majority of mental illnesses are lifelong and incurable. And can you let us know whether you think that's a myth or whether you think that's a fact? And let's see what people have come up with there. And great, yeah, this is great to see. Everyone thinks that this one is also a myth and that it's not true. That, yeah, we know that for the majority of people, mental illnesses are treatable and that they can recover from them, and that there are some really good and effective treatments. And what we also know is that when people are treated early, that the impact on them and the recovery is better. So I guess that's something else to think about, and that we're encouraging people to go and seek support and to challenge the sort of the stigma and the concerns that people might have about getting help around their mental health problems. Okay, and the final one that we've got here is, if I talk or I ask about self-harm or suicide, I might put ideas into someone's head. And I guess what we want to know here is if you think that's a myth or a fact. Okay, so let's see what people have come up with this one. And again, 100% everyone thinks that's a myth. So this is really great for us to see, because I guess we think that that's a myth too, that what we know is the evidence says that actually if you talk to people and ask them about self-harm or suicide in a respectful way, they're more likely to talk about it with you, and that actually a lot of young people worry about talking about this stuff and so don't seek help. And so if we can, the only way we can find out is sometimes by asking them. So this is, so I guess what we're often, people will say to us that they're worried that that might happen. It doesn't look like any of you are, which is really good to hear, but I guess it's also encouraging that idea that it's okay to talk about these things, and that people shouldn't be worried about the stigma or worried of what might happen, and that people can be looked after. So, thanks for answering those questions. I guess what we want to talk about is that when we think about the prevalence of mental health issues in young people, we know that actually adolescence and being a young adult is the sort of prime time for people to develop mental health problems, and it's really common for young people to develop mental health problems at that time, and that's why it's also the time when people engage in sports, and when you're working with young people in sports, and there are added pressures for people in sports, especially when they get into competition, in terms of the stresses of being in a competition, being selected, performing, getting selected, not getting selected. And so those added pressures being involved in sport can also increase the chances that young people might develop mental health problems. So this is why we want you and your involvement with young people in sports to look out and know and understand what mental health problems there are out there. So as I said, mental health problems, it's the prime time for the onset of mental health problems, and 75% of mental health problems in adults have started before the age of 25. And about 1 in 4 young people will have a mental health problem in any year. So I guess what we would like you to think about is, how many young people do you know, and how many young people are you working with, and how many are in your sports clubs, and think about a quarter of those may suffer from a mental health problem in that year. So that's an awful lot of young people, and I guess that's why it's really important for us to think about it. So here's some stats from the Australian Bureau of Statistics, and what it shows here is that for young people, they've got very high rates of substance use disorders, and actually that's the highest rates. About 12% of young people have substance use disorders, but also there's high rates of anxiety disorders, and this one here, the orange one, is anxiety affective disorders. And what affective disorders includes is things like depression. So if you total those up, that's a lot of young people, that's 15%, 6%, 12%, who might be experiencing mental disorders in any one year. And if you think about how that might relate to your population of young people, there are potentially a lot of young people that you're working with that might be struggling. And what we also know is that less than a quarter of young people will go to a mental health service to seek help. And of that group, it's much less likely for young men. So I guess that's another thing to think about in your sports groups, particularly if you're working with young men, that actually a lot of them won't be seeking help and won't be accessing services. So your contact with them is likely to be the only contact they're having with someone who might be able to support them around their mental health and also encourage them to go and seek help. That's why we think it's really important to talk to people involved with young people in sports about mental health issues. So research has shown us that stigma and embarrassment and also not knowing enough about mental health were the top two reasons for young people not to get help for their mental health problems. And that's something that we can all play a part in encouraging and overcoming, is the stigma, and also encouraging better knowledge about mental health. And certainly in your work with young people, you have a role in doing that. Okay, so I've talked about young people, but there's also started to be some research on elite athletes. And here what I'm talking about is a study done on elite athletes in Australia. And what was found was that in Australia, elite athletes reported similar levels of mental disorders to the general population. So the stats that I showed you earlier, that's about the same levels of mental health problems in elite athletes. So it is a problem for athletes, and it is a problem for sports as well. And I think that's why research has been happening more and more about looking into the mental health of athletes. The other thing to really point out was that injured athletes, or athletes who were going into retirement, were also much more likely to have symptoms of depression and to have symptoms of anxiety. And I guess that increased stress of being injured, not being able to perform as expected, or going into retirement and not knowing what to do next, was much more likely to increase the risk of athletes getting disorders. But I guess that also would indicate that, you know, young people in competitive environments who perhaps don't get selected or miss out on getting selected, or are told they can't play or they're not good enough, are also at greater risk of getting mental health problems. And just like young people are less likely to seek help, so are athletes. And I guess so that's a double whammy there, really. And I guess that's another reason that's really important for you to promote environments where help seeking and understanding of mental health problems is encouraged. And just to let you know, at Orygen here, some researchers have done a review of all the literature around the mental health of elite athletes across the world, and globally the results are very similar. So as I said with the Australian athletes, that the prevalence of mental health disorders in athletes across the world, and a lot of this research was also done looking at European football or soccer players, but also in other countries, has shown that the prevalence of mental disorders is about the same as the general population, and that injury and retirement cause increased risk of mental health problems. So this is a problem, and it's something that, you know, the athletes aren't immune from. So it's something that we need to think about when we work with young people who are involved in sports. So some of the effects of mental illness. So what we know is the World Health Organization says that the global burden of disease for mental health problems is very high. And what that means is the cost to the individual, but also to society, of mental health problems is large. And depression is one of the highest global burdens of disease for the of all illnesses, and that looks at cancer and all of the different, and obesity and heart problems. And so some of the effects of mental illness can be reduced quality of life, can be family disruption and conflict, legal problems, homelessness. We also know that the physical health of people with mental illness is much poorer than the general population. People with mental illnesses, their employment, their education activities are much more likely to be disrupted, and so also their sports performance is going to be affected. People with mental illness are more socially isolated, they're much more likely to engage in substance use, and they're also, as I said, the educational disruption and failure. So there's lots of massive effects of mental illness that impact on the person who's suffering from the mental illness, but also their family and their friends, and generally society. So it's really important for us to think about how we can tackle mental illness. And as I've mentioned, if we can tackle mental illness early and intervene early and get people treated and effectively so they recover, then these effects are much less likely to occur, and can and so that the impact on that person is much more likely to not be as disruptive. So it's really important, again, for young people to seek mental help for their mental health for that reason. So I guess there's lots of things that can make young people more likely to be at risk of mental health problems, and the way that we think about it when we think about risk factors is some of the things that are in the past that have happened to people that make it more likely that they might be at risk. And I guess what should be good for you to think about is, who are the young people that you're working with? What are some of the factors that are occurring in them, and do they fall into any of these groups? And if they are, I guess it means that they may be more likely to get a mental health problem. Now, none of these risk factors mean that they are guaranteed a mental health problem, but it's just something to look out for and to notice and to think about when you're working with young people. And so things like age, well, as I said, between adolescence and early adulthood is a high risk factor for mental health problems, but gender is also an issue. We know that there's some mental health problems that women are more likely to get, such as depression and anxiety, but also some mental health problems such as substance use that are more likely to be seen in young men. Cultural background, social isolation, things like that we know that also cause more risk and may lead people to get a mental health problem, but also some history of mental health problems means that people might also get a mental health problem in the future. When we also look at risk factors, we also look at the things that are going on right now that might be putting added stress onto young people that might lead them to develop a mental health problem. So things like family conflict, a loss, and a loss might be something like missing out on getting selected for a team, but also bullying. If something traumatic happens in their life, they're involved in an accident, but also things like physical health problems and injury make it more likely that someone might develop a mental health problem. So I guess it's for you to think about these things and think about how they might be affecting some of the young people that you're working with. There also are protective factors, and they're things that make it less likely or buffer people from developing a mental health problem. And I guess those things that can include being involved in positive sports environments, but also things like so engaging in sporting activities, but also good physical health. But having a good support system around you and having people around you like family members is also a really protective thing for young people. So what we talk about when we talk to young people about mental health problems is the bucket. And the way that we think about the bucket is that all of these risk factors add up for add up in the bucket. And I guess one of the questions that's just come up is about is there any evidence for heritability? And the first thing we've put in this bucket is genetic vulnerability. So there are evidence to suggest that there is some genetic vulnerability that people can have. So if a family member has a mental health problem, there is some chance that they are more likely to develop a mental health problem. But I guess that's along with a lot of other factors. So, for example, moving away from family, if someone has to go, if someone's been selected to play in a sports team that involves them moving away, that might increase the risk because of their social connections being further away. The pressure of competition and needing to do their best might also add to the bucket of stressors. Relationship difficulties, physical injury, substance use, poor performance, and that might lead to their bucket overflowing. And when the bucket overflows, that's when mental health problems are more likely. So we talk to young people about what's filling up their bucket and is their bucket overflowing. We also know that the protective factors are the things that can kind of drill holes in the bucket and empty the bucket out. So things like social networks or coping skills or different lifestyle factors. So they're the things that kind of stop the bucket from overflowing. And I guess when you're thinking about mental health problems in young people, it's about thinking about how all of these factors influence them. And no one factor is guaranteed. It's just how the combination of factors for that particular young person affects them, and whether they've got the positive factors to reduce the likelihood of those and buffer against the mental health problem developing. So that's just a quick overview of some of the things that increase the likelihood of mental health problems for young people. But I guess it's a good, the bucket model is a really good way of conceptualizing that, and sometimes even you could try and explain that to young people in that way if they're not understanding what's going on for them, and often they really engage with that kind of idea of the bucket. So now we're going to talk about some of the signs and symptoms and what you can look out for when you're starting to worry about a young person, and what signs and symptoms mean that you should worry about a young person. So the way that we think about that is that we look at how a young person is feeling and what feelings they're experiencing, but we also think about what they're thinking, how they're behaving, and what physical changes they're experiencing. And overall, that really links to how they're functioning. And when Karen was talking about the definitions of mental health and mental health problems and mental illnesses, she highlighted that functioning is a really important part, and that's something we can look out for, because if someone's functioning is being affected, then it's likely that they might be developing a mental health problem and moving along the continuum to the more severe end. So that's a really important part and key for what to look out for. So what we'll do now is we'll go through some of the more common mental health problems, and we'll just give you a quick overview of some of the signs and symptoms that to look out for, and what and how they're linked to certain mental health problems. Obviously, we can't cover everything in the webinar today, but we're just going to give you some ideas. So we'll start off with depressive disorders. And depression is not just about feeling sad or down, and a lot of, and it's not normal in adolescence. You know, the moody teenager thing is not the same as being depressed. Depression is a prolonged experience. It affects functioning in a range of areas, such as relationships, people's health, their school, their work, their sporting performance, and it's also one of the most common mental health problems for young Australians. And we think that, you know, depression is a really difficult thing for anyone to experience, and particularly for young people to experience. It affects 6% of young Australians at any time experiencing depression. So if you think about the young people that you're working with, I guess it's highly likely that some of them might be experiencing depression. And we also know that if people experience one depressive episode, they're more likely to, half of them are likely to experience another depressive episode. But despite the rates of depression in young people, we know that many of them won't seek help, which is why we're kind of encouraging people working with young people to kind of understand what depression is and be aware of it, to kind of encourage young people to go and seek help. And also that this is not just something that occurs in young people, that that athletes also report high levels of depression, and so it's something that we really need to think about when we're working with young people in sports. So what are the signs of depression? So when young people are feeling depressed, they might feel sad, they might feel down, they might feel empty, they might feel numb. Often young people who are feeling depressed are also feeling irritable or have anger outbursts. And so they're the things to look out for when you're looking at what young people are feeling. They also might be worried or anxious. Some of the thoughts and some of the things they might talk to you about is feeling hopeless, feeling like nothing will get better, feeling helpless, like no one cares for them, that they can't do anything, and also having lots of self-critical thoughts that they're not good enough, that they can't, they're not doing well, that they're worthless. So the other things that young people might experience in terms of their thinking is they might have difficulty concentrating, they might have difficulty making decisions, and they might also be having some suicidal thoughts that they might express to you. So I guess that's the kind of things that we'd be looking out for when we're thinking about the changes in thinking related to depression. How are they behaving? So they're things that you might notice. They might start looking more dishevelled, they're not really taking care of their appearance, they might withdraw from activities that they're normally engaged in, they might withdraw from their families, their friends, start missing school or not coming to training sessions. You might notice them crying, you might notice them actually starting to engage in some risk-taking behaviours or substance use, things that they normally didn't do in the past, that they might be a bit more reckless, and also that their school performance or their sports performance might be affected. And in terms of the physical changes that a young person might experience when they're depressed, often depression is linked to low energy, low motivation. People might be very tired. It affects their sleep, so they might be sleeping a lot more than they used to or a lot less than they used to. They also might have a change in their appetite, so they might be eating a lot less and losing weight, or perhaps eating a lot more. So there's lots of physical changes that also might happen. And another thing that you might that can be linked is just feeling really run down and getting sick quite a lot. So all of those things are the things that link to and are signs of depression that you can look out for, and young people might talk to you about, and those things can really affect how they're functioning. So they're the things that you need to kind of notice. Okay, so when we looked at the statistics for mental health problems, anxiety disorders were very common in young people, and the anxiety disorders are also, of all the mental health problems, the ones that are most likely to start at a younger stage. So they're really common in young people, and they're also very common at starting and developing and affecting people's lives across the lifespan. So the word anxiety is used to describe any response to a feared situation, and it's a normal response that everyone experiences. And it's that part of the fight or flight response, that a survival mechanism that our bodies are made to experience to help us survive in the world. And it is an adaptive function, but unfortunately, in an anxiety disorder, it becomes a problem, and it becomes a problem because it's severe. It interferes with someone's functioning, and it can be disproportionate to the feared stressor. So what happens then is people start avoiding or trying to minimize their contact with the feared thing that they're experiencing. And this can be a real problem, because if they're worried about talking to people or embarrassing themselves, then they might start avoiding situations that are social, and so stop going to school or stop going to sports activities, or even just leaving the house, and then that can become a real problem. So anxiety disorders can really impact on people's lives, and are also linked with other mental health problems. So it's something that you need to look out for. often anxiety is linked with performance, and a lot of sports people in particular adrenaline rush to kind of feel at their peak. But what the research shows and what we know about anxiety is that there is an optimum level. Too little anxiety can lead to boredom, can lead to lack of motivation, can kind of stop people from even trying. But also too much anxiety can lead to over-arousal, anxiety attacks, or high levels of avoidance. So although people do need some level of anxiety to kind of get themselves going, an anxiety problem is where it gets too high and it pushes people over the edge and starts really affecting how they're able to live in the world and get on with life. So some of the anxiety disorder statistics is that it's actually the most common mental health problem in young people, affecting 1 in 6 young people. So again, if you stop and think about all the young people that you're involved with, and it's likely that at least a few will have an anxiety problem. Anxiety is more common in women, but also it does occur in young men. And also the most common types of anxiety disorders, and I'll go through a list of them in a moment, are social anxiety and also post-traumatic stress disorder. But there are a range of anxiety disorders that young people can experience. And the reasons, you don't need to know the different types, but they're often related to kind of different things. So social anxiety will be linked to worries about how people are perceived by others, and that can lead them to avoid social situations or doing things in front of other people. Post-traumatic disorders, a disorder that's linked to a fear response after a very traumatic event. So that could be a car accident or something like that, or being involved in a sort of natural disaster like fires and stuff. So these are things that young people can experience. They're also very common in Australian athletes. And as you can see, social anxiety, again, is one of the most common anxiety disorders in athletes. So again, what are the signs and symptoms of anxiety disorders? What should you look out for? So people who are anxious are likely to be worried, to be afraid, quite restless, irritable. They might talk about feeling on edge or stressed or keyed up. So they're the kind of feelings that you would be looking out for. The kind of thoughts that are linked with anxiety disorders are an overestimation of the threat in the environment. So an overestimation of how much danger a situation will put them in, or an underestimation of how they will cope. I won't get through this. I won't be able to manage. It's too much. It's unbearable. The other things that can happen, young people might describe their thoughts racing, being overwhelmed with their thoughts, or going blank and not being able to think at all. And so they're the kind of things that young people might talk about when they're experiencing an anxiety disorder. The things that they might do, so avoidance is a really big behaviour in anxiety, so avoiding the feared situation and avoiding the thing that makes them anxious, and that can lead to avoiding people, places, different activities. But also it can lead to another behaviour is seeking reassurance from others. Am I going to be okay? Will you come with me? And asking people to help them get through the thing because they can't they don't think that they can cope on their own. Another thing might be checking and making sure, repeatedly checking something to check that it's okay. Other things that young people might do in response to the anxiety disorders is use substances, because substances might help them get through the situation, help calm them down, help them feel okay in a particular situation, and that can obviously lead to problems like substance use disorders. They might also be quite aggressive or agitated when they're feeling anxious. Some of the physical changes they can experience because of the fight or flight response, the kind of things that happen to the body when people are anxious is they can feel an increased heart rate, difficulty breathing, tightness of chest, sweating, shaking, butterflies in the stomach, dizziness, and they're all associated with autonomic arousal and the kind of physical things that can be associated with anxiety disorders, so young people might talk to you about those things. And again, all of these things affect their functioning. So here's just a list of the anxiety disorders, or the most common anxiety disorders that occur. And again, it's not about you knowing all of these anxiety disorders, but just understanding that there is a range of anxiety disorders and they can affect young people in different ways. So phobias are anxiety disorders related to fearing a specific thing. So often people can talk about, spider phobias and things like that. So fearing spiders and avoiding situations where they might be linked to that. As I mentioned, social anxiety disorder is a fear of social situations or particular social activities. Panic disorders is where people have panic attacks, and that can often be linked to other disorders, or it can be a disorder on its own. Agoraphobia is about not being afraid of open spaces, and so often people get stuck at home because they can't go to places where open spaces will be outside. And generalized anxiety disorder is a disorder where people worry a lot of the time about a range of different things, and that can affect their ability to do a range of activities. Other anxiety-related disorders are obsessive-compulsive disorder, and that's frequently associated with worries and concerns that leads to compulsive behaviours like checking or hand washing or counting and things like that, and post-traumatic stress disorder, like I mentioned. So there are a range of disorders, and I guess what we would say is to encourage young people to go and seek advice from a professional and get that diagnosed, and so they can understand what type of disorder they have better. So now I'm going to talk about substance-related disorders and addictive disorders. And as you saw on the graph I showed earlier, substance use disorders are at the highest levels for young people, and large numbers of young men also have substance use disorders. And substance use disorders and addictive disorders can lead to a vicious cycle of problems that just reinforce the behaviour. So people can get trapped in the disorder, in a way of behaving that can lead to a lot of problems in their lives. It also has links with sports. It can, we know that the gambling is heavily promoted in sports things, and young people are very susceptible to that and can start experiencing gambling problems because of that, and also binge drinking culture that can be linked to sports activities. As we talked about earlier, injury and retirement are also big stresses for athletes, and that is very much linked to substance use problems, and so it can be a key concern for people at those times. So it's a really important thing to think about. And when we talk about substances, we're talking about anything that is ingested to cause an effect to how someone is feeling and thinking. So that can be alcohol, drugs, or prescription drugs. And problematic patterns can develop in a chronic way, so people can start using daily, but also in a binge pattern, and they can cause problems to people's behaviour just as much as using on a daily basis. So this is a graph that shows the average age of substance use, and as you'll see here, the average age for a range of substances, and we've got alcohol, prescription drugs, cannabis, all the way through to methamphetamine. The average age is between 15 and 20. So that's when young people are most likely to start using substances for the first time in their adolescence. So it's a key time to think about substance use, and some of that might be experimentation, but we know it can lead to more problematic patterns. So substance use disorders affect 1 in 5 men and 1 in 10 females. So it's very common, and particularly in young men. And of all substance use disorders, alcohol use disorder is the biggest problem, with over half of all substance use disorders being alcohol use disorders. And often young people won't get help for this, so it's really important for us to sort of recognise this and encourage young people to get support. So here's a graph looking at problematic alcohol use, and problematic alcohol use is defined as 4 or more standard drinks on one occasion. So, as I said, that could be on a daily basis, but as you see here in this graph, it's quite a small proportion of young people drink to such high levels on a daily basis. But in a more binge drinking level, young people show the highest rates, with nearly 50% of young people drinking at least once a month in a binge pattern of problematic alcohol use, but also over 1 in 5 young people doing that on a weekly basis. So it is something that we need to think about, and it can be a big problem for young people. When we think about drug use, this is a graph showing different substances, cannabis being the most common drug used by young people in the last 12 months. And as you can see, 1 in 5 20 to 29-year-olds will use cannabis in the last 12 months, but also 15% of young people between 14 and 19 will use cannabis. So it's a very common drug, and it's the second most common used substance after alcohol. So it's something to worry about. The other thing to note is that people with mental health problems are 5 times more likely to use substances than people without mental health problems. So young people who are struggling may turn to using substances. So it's something that, and that can cause even more problems. So it is something we need to think about. And again, what are the things that you might notice of people using substance when people are having substance use disorder? So some of the things they might be feeling: sudden mood swings, irritability, anger outbursts. You might notice that they're anxious or on edge. They might, what are the things that they'd be thinking? They might have a change in the way that they're thinking, or in their attitude or their personality. They might suddenly start saying, not really caring about things that they used to care about, or not wanting to do things that they did in the past. They might start getting paranoid, or might have difficulty concentrating. The things that young people might do in terms of changes in their behaviour is that, again, they might have lack of motivation. They might also change their appetites. They might eat differently, so they might not be eating as much or eating more. They might start acting in ways like stealing or behaving more dishonestly. They might have different friendship groups or different places that they go and hang out as a consequence of the substance use, and they might be getting into more trouble, whether that's trouble with the police or just getting into more fights with their peers and things like that. Some of the physical changes they experience are feeling lethargic, spaced out, being more hyperactive. They might have changes in when they're actually high, and they might be sweating or feeling nausea. So there's lots of physical changes that they can have, both when they're on the substance, but also when they're withdrawing and craving the substance. What we know about substance use is that particularly illicit substances, if people are engaging in competitive sports, it might be that they're not using it when they're getting tested for drugs, but in off-season that they might engage in some of that substances. And as I said also, that alcohol use is something that's very common in young people, and also might be affecting athletes as well. So it's something to think about there. Gambling is also something that is becoming much more of a problem in young people, and we know that young people are more likely to develop gambling problems than adults, and I guess part of that might be the normalisation and the culture of gambling in Australia, and the apps that are available that mean that young people can get access to gambling more easily. And the difficulty with gambling is that often young people don't see it as a problem, and don't realise when they're developing problems, and don't seek help for problems. So I guess it's something to be aware of, that these problems can kind of emerge and young people won't get help for them. I'm also going to talk a little bit here about body image and eating disorders. What we know is that body image and eating disorders affect young people's mind, and they also affect their bodies and how their physical functioning. Sorry about that. And body image disorders and eating disorders are linked to a lot of difficulties, including anxiety and depression, but also they can be problems in themselves. And these are problems for young women, but also it's a rapidly growing problem for young men. And also the research shows that athletes are particularly vulnerable to poor body image. And I guess one of the things that we do ask people involved in sports with young people is to think about what culture their club is promoting in terms of body image and eating, and because sometimes we can be sending the wrong messages out about needing to look and be a certain way to achieve, and that can really cause problems and lead to young people engaging in behaviours that can be very harmful to them. So I guess this is just a quick overview, and we've only kind of touched on all of the issues. And really, you know, we would encourage you to go and find out more, and Karen is going to talk to you about where you can find out more of this. But some of the eating disorders that young people can develop, and as I said, athletes are vulnerable to these as well, is anorexia nervosa, bulimia nervosa, or binge eating disorder, and they're all linked to how people perceive their weight and wanting to lose weight, and that can really affect their eating and things that they do around that. But also things like body dysmorphic disorder, which is linked to how people view themselves in certain parts of their body and wanting to change certain parts of their body. And one aspect of body dysmorphic disorder is muscle dysmorphia, where people feel a need to have larger muscles. And that can really be linked to athletes, and particularly male athletes wanting to bulk up, and sometimes is linked to sort of unhelpful things like steroid use. So they can be big problems that can cause young people physical health problems as well as mental health problems. Okay. So I am going to now pass on to Karen, who's going to talk a little bit about youth suicide and deliberate self-harm.
Okay, we're travelling along with our timing, and so we won't spend a lot of time talking about youth suicide and deliberate self-harm. There are also some other newly added resources on the Orygen website, so if this is a topic that you're particularly interested in, we would encourage you to go back to the Orygen website and have a look around. There was a webinar recently completed about deliberate self-harm, and there are some other resources around suicide for you to have a look at. But we did want to touch on it because we know that youth suicide and self-harm are strikingly, tragically common, and that suicide is actually one of the leading causes, and sometimes the data tells us that it is the leading cause of death for young Australians. So up to 31% of all deaths of young Australians are as a result of suicide. So it's an enormous problem, and although we're not wanting to be alarmist, we did think it was worthwhile pointing out that the consequences of untreated mental health difficulties can be devastating. And so we wanted to sort of underscore the notion that it is critically important that people who do present with mental health problems are encouraged to get proper support, intervention, and that they're help seeking, because the consequences can be so high. So we know that males are more likely to complete suicide, but females are more likely to attempt suicide. Self-harm is more common in young women than in young men. So if that's an area that you would like to know more about, have a look on the Orygen website and check out those resources. But we just wanted to really underscore the notion that these really catastrophic outcomes are much more common when there is an untreated mental health problem in a young person. So if you're starting to notice some of the signs and symptoms that Reem has pointed out, it can be really important that we that we either refer or consult with mental health services to try and get the best help we can for young people to avoid these really catastrophic outcomes. Okay. So we wanted to spend the last few minutes thinking about what your role might be, and it will vary. I know from the quiz question at the beginning we found that some of you are in a role that has a specific wellbeing focus, but many of you aren't. Some of you might be volunteers at a local sporting club or parent helpers, and so it can be difficult to hear all of this information about mental health and think, what am I supposed to do about it in my role? So we thought we would spend a little bit of time thinking about what are the things that you can do, what is the change that you can help to facilitate. Now, we spoke at the beginning about the problems that occur for young people with stigma, and that is about the view that they have either themselves about what it means to have problems with your mental health, or also what other people might think of you if you have trouble with your mental health. And it is one of the absolute biggest barriers to young people getting the support and treatment that they need for mental health difficulties. And that is something that all of us can do something about. So within your sporting organisations and clubs, or within your schools, it is very achievable that you can start to bust some of those myths around mental health difficulties, to talk to young people about how common these difficulties are, that if it's happening for them, it's highly likely that it's happening to several of their friends at the same time. So really breaking down those notions of that there's an issue for them that makes them different from others, that there isn't something that is weak or vulnerable or different about them, and that this is something that does happen really frequently to human beings, that's part of being human. So that the way you talk about issues around mental health, the way your club allows others to express what's going on for them. I think if you think about the stereotypical male sporting environment, it can be really difficult to be the person who says, I'm not actually coping very well with the pressures that I'm under. So one of the things that you can do to help facilitate good outcomes for young people with mental health problems is to really think about what are the messages that we're sending, what is the culture within our sporting organisations. We also know that when young people have had a good experience at talking to somebody about their mental health, then they're more likely to feel okay about seeking treatment when they need it. So, and similarly in the negative, if they have a very judgmental or hostile or difficult response to first disclosing that they're having difficulties with their mental health, that they're less likely to be able to go on to seek support. So it's another very important role that all of us as adults in young people's lives can play. You don't need to necessarily have all of the answers, you don't need to be a therapist, you don't need to be able to help with diagnosing, but you can have a conversation that is non-judgmental, that is supportive, that is encouraging, and maybe even hopeful that treatment is available and that things can improve for a young person. So if you happen to be the first person who notices that something has changed for them, and you happen to be the first person having a conversation with them about your concerns and the things you've noticed, how you go about doing that can be a huge facilitator in helping the young person feel okay to talk about this stuff that can be really hard for them to do. Okay, so what you can do, although you're not necessarily having to be a therapist or an expert, you can, we've talked about, go a long way in reducing stigma, not allowing people to be talking in a disparaging way or a stigmatising way about mental health within your school or sporting environments. You could make a decision as a club or as a school to be raising awareness about mental health issues so that people know a little bit about what they're looking for, that they're knowing about how common they are, and developing a safe culture where it's okay for people to talk about mental health and substance use issues. There are actually some really wonderful resources, for example, on the AFL football website, where there have been some very gutsy and brave elite sports people coming out and talking about their own difficulties with mental health. And I think those examples are very powerful for young people to say that even the people that you idolise and who look up to or who perform at a very high level can also struggle with mental health difficulties, and they have been able to talk about it and they're still admired and still performing at high levels. So I think those stories can be really powerful for young people who are experiencing these things. Promoting early help seeking and assisting young people to seek help. It's really important that you as a support person know what your local options are, so that if you're noticing that things aren't going well for a young person, that you're able to say, hey, did you know we've got a headspace down the road? Or did you know that the Players Association have a list of confidential places that you can go and seek some help? So I would encourage you to all go away from this webinar and have a think about what are the resources in your local area that you could be guiding young people toward. Do you know the number of the local mental health service if you're particularly concerned to be able to give them a call and discuss a young person? So I think that is something that you could all be doing, possibly even having some resources from your local services up and visible and available within your sporting organisations can be helpful. And promoting hope that things can improve. I think one of the things that we know is that young people feel like they're the only ones, and that also that it means that something is a bit wrong with them or a bit not quite right, and that they might not feel that there's much hope that things will be different. And that's a message that is very powerful and makes it very hard for them to make a decision to do something about their mental health difficulties. So that's a message that you can absolutely give, that there is hope and that with the right treatment things most often do improve for young people with mental health difficulties. Okay, so a couple of the key messages in wrapping up. Things that you can do are know when young people need help. So knowing that it is highly likely that some of the young people that you're working with will be struggling with their mental health, and that that you can look out for signs and symptoms, that you might be the person who notices that things are changing. Just knowing that this is the age bracket where people are most likely to be developing problems with their mental health is very important. When you've known a young person for a long time, you're in a particularly good position to be able to notice when things are changing, and it's that change in somebody's functioning that is really critical. So you're in a good position when you've known a young person for a period of time to pick up on those changes. So knowing when young people might need help is one of the very important things that we would like to encourage you to be thinking about. Guiding young people to seeking help, we've spoken about, and being aware of your local services. Really important things that all of us can be doing and be doing better at. Okay, so we've had some questions asking about what types of resources we might be able to be suggesting for young people, and I thought we would show you a few of those. We'd actually like to encourage all of you to pull out your smartphone, your mobile phone, and to put in some of the details for the local help services, and potentially for some of the helplines like Kids Helpline for under 25-year-olds or Lifeline for over 18-year-olds. If you begin having conversations with a young person because you've noticed that something is going wrong and they disclose something that is of great concern, it can be a really difficult time to be thinking, oh, what do I do? Where do I go? So having ready access to these resources can be really helpful. So we'd like you to go away at the end of this and have a think about where you would like to guide people. There are now many Headspace centres around Australia that provide Medicare-funded services to under 25-year-olds, 12 to 25-year-olds. So it would be very much worthwhile you knowing whether you have one in your local area, and you can find that on the Headspace website, and also where your local mental health service is. What's their phone number? How would you know where to go if there was an urgent need for a referral? There's some good information now on the Orygen website, so we'd encourage you to, if you've got an interest in this area, to have a look at some of our training modules. We have some modules on anxiety, on depression, on self-harm, so you could check those out. They're free resources for anybody who'd like to access them. We have quite a library of Mythbusters that can be quite useful for young people and the community to check out. So we've got them on self-harm, on suicide, on anger. So, have a little bit of an explore of our website. You might find some useful information there to use in your work with young people. And the Headspace website is full of great free resources, fact sheets, information about where centres are, what help seeking might look like. So these are not only resources for yourself, but they're also things that you can help to show to young people who you might be concerned about. Helping them to wade through the internet and find information that is good quality information can be really useful. So we would suggest that if you're worried about a young person and you're wanting to have a chat with them, sit down with them with their phone or with the laptop and have a think about doing a Google search with them and having a look through some of these websites with them can be a really great way to start the conversation going and to leave them with somewhere to go once they've left you. Okay. So, Reem, we might have a look at some of the questions that have come through and see if we can go about answering some of them. Early on, somebody was asking the question of does the research suggest that stigma is worse for sports people? And I think we might have touched upon that, but we know that athletes, elite athletes in particular, have particularly poor attitudes to help seeking. And although their rates of mental illness might be pretty similar to that in the general population, which is relatively high, we think that the data is suggesting that they do have more trouble help seeking than the general population would. And so you think that, yes, it is probably due to stigma, that I guess if you're competing for a position with your team or competing for a spot, it can be very difficult to say, I'm struggling with something and I'm not coping, and I imagine that people worry about how that information will be used. So yes, we do have reason to believe that stigma might be a bigger problem in elite sport than it is in the general population, and that is saying something because stigma's pretty awful everywhere. Yeah. Okay. Some of these questions we have addressed throughout the presentation, so we won't go over them again. We've had a question about how can we use sports connection in helping to improve mental health for young people, and I hope we touched on that at the end. But we think that the connections and the social belonging are so very important for young people who are experiencing mental health difficulties, and sporting organisations are just the perfect place to help young people to remain connected and to feel that they have a place to belong and to notice really early when things are going wrong. So I think that needs to be something that sporting organisations think about, that this may be a place that can be very protective and also a place where young people can be picked up early if things are starting to go awry with their mental health. And also a place where some of those myths and stigma can be absolutely tackled head on. So I think there's actually a really large role for people within sporting organisations to play. Okay, we've talked about, people were asking you for any resources and websites, so hopefully we've given you some of those. There's a question about whether we would recommend routine screening. I presume that means for mental health difficulties when athletes are having physicals. What would your thoughts be, Reem?
I think that would be a wonderful idea. I think it's a really, as the question there does mention people being injured and when they're leaving the game, and we know that they're key times, but also just the competition of sport. If people are getting regular physical checks, then incorporating mental health screening in that as well also promotes the idea that mental health is just as important as physical health, and it is something that we need to think about. But also by asking those questions, it's a time when young people who might feel worried about talking about these things are more likely to open up and say, yes, actually that is something that's been bothering me, whereas they might not just freely reveal that
volunteer that information. Yeah. It's really difficult to approach somebody out of the blue and say, actually, I think I'm having trouble with my mood, or I'm finding that I'm crying more than I used to, or I'm so fearful about my performance on the field that I'm having trouble sleeping the night before. Those are very difficult conversations for many young people to raise. So screening might be a great place for them to be able to just tick a box that says, yes, actually some of these issues are happening for me. So it might be something that you could think about incorporating if you are doing regular health screening. Yeah. Okay, we're heading on in time, so we don't have a lot of time for other questions. But we'd like to thank you for participating and to let you know of a few other resources that we have available for you. A reminder that we will be sending you a statement of participation in the webinar today. We would love to receive any feedback that you've got for us. And also that the webinar will be available online. So if you have colleagues who would have liked to have seen it, or you're wanting to come back to it and have a look at any of the information that we presented today, keep an eye on the website. We'll let you know when this webinar has been uploaded. We have some online training available for people who are working with young people. I know that clinicians of a certain vintage, people of a certain vintage, are finding that we're struggling a little bit to keep up with what's going on with young people and their use of technology. Orygen are fairly excited to have partnered with the Young and Well Cooperative Research Centre and Michael Carl Gregg to develop some online learning modules in young people's mental health and technology, and how we can use mental health technology to improve mental health outcomes for young people. So if that's of interest to you, you might like to go and have a look at those modules. Orygen are also available to deliver training for you in your workplaces around Australia. So if you have particular things around youth mental health that you're wanting your workplace to learn more about, send us an email at training@orygen.org.au, and we would be really happy to talk to you about how we might be able to tailor some training to meet the needs of your workplace. Okay, thank you for your attendance. We're very pleased that people have been interested in hearing about this subject today. We know that mental health services are only seeing a very small fraction of the young people who are presenting with mental health difficulties, and it is very encouraging for us to know that there are people who are working with and volunteering with and coming into contact with young people who also care about their mental health outcomes. So thank you for your attendance, and we hope you got something out of the webinar today. Thank you.